So why did I decide to be a plastic surgeon? Let's go back early childhood. Let's not go too far back. My nickname when I was a child was Danny No. And the reason was because I would touch everything. I started tinkering in my father's garage. Now, my father is an electrical engineer. Let's put it this way. If you've ever seen the movie Frankenstein with all sorts of gadgets that light up and make noises, you can imagine how fascinating it is to a child. And it was always that desire to use my hands that I think strongly influenced my desire to be a surgeon. I did my general surgery residency at the University of Mississippi Medical Center in Jackson, Mississippi. And the plastic surgery service had a patient that was morbidly obese. She weighed about 700 pounds. Her skin was so severe, the abdominal pannus, what we call that fold, was down to her knees. And it made her unable to walk. She was essentially bedbound. So imagine logistically the amount of people that had to be in the room in order to perform this surgery. Anesthesia team, surgery team, scrub tech, circulators. It was at least somewhere between 15 and 20 people in the room. It's almost like an opera or a symphony where every member is a different cast member and has a part to play in the final result. And actually, when we removed it, the weight of it was 90 pounds. So as you can imagine, it's impossible to have people holding that in surgery. So that was the first true tummy tuck that I ever took part in, basically as an observer, but the interest that it developed in me, the passion for seeing what removing skin and fat can do for a patient's life. You don't really start to operate until about your third year of general surgery residency, but our program was very clinically oriented. So as early as our first year, we were spending a lot of time in the operating room. So it had a lot of benefits. But during my time there, I gained 50 pounds. I was up to a size 40 waist. My blood pressure was high, and I just did not feel well with myself. One of my co-residents, who I will always be grateful to, took me aside one day and said, "You know what? It's time to go to the gym." And I went kicking and screaming. But after a few months, I started actually liking it. So much so that in 9 months, I was able to lose the 50 pounds that I had gained, and for the first time in my life, I actually had muscle. It really gave me, since my childhood, self-confidence. In my childhood, I was always, a little chunky, which is normal for Latin boys. So when I'm talking to my patients about self-confidence, when I'm talking to them about how surgery and weight loss can change your life, not only do I know because I'm the surgeon, but I know because I went through it. One of the biggest sources of inspiration in my life have always been my parents. My father emigrated to the United States, fleeing communist dictatorship in his teenage years. And he came here with the shirts on his back, his entire family. Education was the only thing that made him successful. And he imparted that sense of education on me. So I guess you could say that it was a combination of my parents, my experiences, and as well as personally having gone through my own physical transformations that led me to become a plastic surgeon. And I am forever grateful to all of those that helped me along the way. Remember, there's no such thing as a self-made man. At every point along the way, there are people there to help you and push you, and I definitely had mine. So I'm Dr. Daniel Careaga, and that is my story of how I became a plastic surgeon.